Hello and welcome back to Einstein's Eyes, your trusted source for all things ophthalmology. I'm Carl Rosen, oculoplastics and neuro-ophthalmology in Anchorage, Alaska. This is my friend and partner on the channel, John Didkoff. John,
Nice to meet everybody. I'm John. I practice ophthalmology, general ophthalmology for almost 30 years now in northern New Jersey. I also specialize in cornea. Carl and I did our training at Albert Einstein, hence Einstein's Eyes. And this channel started really with ophthalmology, and now we've kind of branched into other things. And the subject today is very interesting for us because it relates to a very popular medication, but its impact on eye problems. Carl, you want to introduce it?
sure. So we're going to dive into a topic that might surprise you, but it is a link between Viagra and eye health, specifically something called ischemic optic neuropathy, or NAION, non-arteritic ischemic optic neuropathy. Now, there is an arteritic variety, but we're not going to speak about that. We're just going to talk about the non-arteritic variety and how it relates to Viagra and that class of medication. Uh, so, uh, just so the audience knows, we will be speaking about the weight loss drugs Ozempic as well at a future date, and its relation. It's been new data shows that it too has a relationship to ischemic optic neuropathy, which can affect your vision or your visual field, and is really can be upsetting and devastating to folks. Um, so I'm just going to dive into how Viagra works by increasing blood flow. And this mechanism can also affect the blood vessels in the eyes as well as elsewhere in the body. In most cases, if a user has an issue, it's a minor visual disturbance, sometimes a blue tinge to your vision, increased light sensitivity, sometimes blurred vision. I call it stuttering vision, but the side effects are usually temporary and they resolve within a few hours. The more serious concern, and the reason we're really discussing this, and actually, I was involved in a study funded by Pfizer at Ophthalmic Associates, my practice in Anchorage, is Viagra can lead to this thing called non-arteritic anterior ischemic optic neuropathy, or NAION. This condition is sudden vision loss caused by decreased blood flow to the optic nerve, and it can either wipe out your vision or wipe out a part of your vision. And usually you notice it if you cover one eye, or you'll say something's blurry, and then you'll cover one eye, you'll see that, wow, things are really different. And it can be very, very discomforting and disturbing. Um, but we would caution you we don't want you to freak out. We do want you to, though, to get a hold of your ophthalmologist or your primary care doc. We want you to stop your medication and really promptly get assessed and examined. Now, risk factors include most things that are under the rubric of metabolic syndrome. These things include hypertension, diabetes, elevated cholesterol, hyperlipidemia or elevated triglycerides. Sleep apnea is a big one that we've found, which is a reduction in the oxygen saturation at night. Folks who snore or who never feel rested. And there's also a really interesting anatomic version of the optic nerve that predisposes folks to ischemic optic neuropathy called the disc at risk. And John and I just so happen to have trained with Ron Bird, who was our chairman and was one of the original physicians who coined the term back in the 70s with a guy named Lawton Smith at Bascom Palmer in Miami. There was a bunch of research also at the University of Iowa by Hayray, Hayray Singh, and they wrote the seminal papers on ischemic optic neuropathy and a very crowded optic nerve called the disc at risk. And it's believed that blood flow has a hard time getting through. And folks talk about taking aspirin, reducing the inflammatory response with IV steroids. Nothing has actually been proven to really work. But anecdotally, we do things, neuro-ophthalmologists do things, or neurologists or ophthalmologists do things to try to reduce the inflammatory response and bring back vision. And John's going to jump in, but I'm just going to end with the way I tell folks that I see my patients, I say 30, 30, 30. 30% get worse, 30% stay the same, and 30% get better. And there's always that risk that it can happen. Now, some folks believe if you go a year without the other eye being affected, then you're okay. But I've seen folks who get ischemic optic neuropathy in the other eye even after a year, 5 years later. So it's not a guarantee. But the take-home message is these medications like Viagra, Cialis, they can elevate the risk of ischemic optic neuropathy, particularly if you have metabolic syndrome or those risk factors. John, you want to jump in?
Yeah, I'm going to add a couple of things. So ischemic optic neuropathy, just for you out there, it's a fancy word, fancy term. It's a stroke in your eye. So basically it occurs when blood flow suddenly shuts down, supplying oxygen to the nerve. And that causes either a mild visual loss, moderate, or even severe. And as Carl mentioned, there are significant risk factors for that condition. Forgetting about, I mean, this video is about Viagra, but forgetting about that, 72-year-old guy with hypertension and diabetes, he's at risk for a stroke to his eye, period. I mean, that is the way it is. Now, you add a medication that people really, it's a wonderful medication. People are having better lives, their marriages, their relationships. This is something we don't want to tell you not to use. That is not the message of this video. However, you should be cautious and you should make sure you speak to your medical doctor about it. So couple of good data points. So one of the key things that I found in my research is that if you're taking a low dose of sildenafil, which is Viagra, meaning 25 to 100 milligrams of the medication to cause you to be able to do what you need to do, which is help erectile dysfunction, only 3 to 11% of people have side effects. But when you increase the dose to, let's see, when you increase the dose to 200 milligrams, so you're over doubling, it's like 2.5 times that dose versus a very low dose versus a little bit higher. So basically the odds go 3 to 11%. And then when you go to 100 milligrams, it's 50% of men taking this medication have side effects. And then if you take 200 milligrams, 100% of men have that issue. So now you're talking. So you have to be really cautious with the dosage. Some people think, oh, I'll just take more. More is better. No, you have to make sure you follow your medical doctor's prescription and your urologist's prescription to make sure you're not overdoing it and that you stay on a low dose because the low dose should be effective.
Wait, John, you're not saying 200 milligrams and you'll get ischemic optic neuropathy. You're saying
no. You'll have some side effect, some visual side, and it's actually over 200 milligrams to clarify. But the bottom line is take the dose that your doctor recommends, stay at a low dose. Don't get carried away with this medication because the higher the dose, the much higher risk. And yes, thanks for clarifying that. So other risk factors, so like Carl mentioned, changing color, increased intraocular pressure, et cetera, et cetera. It's not just ischemic optic neuropathy, but that's the most serious thing. So Viagra boosts blood flow by turning off an enzyme that's called phosphodiesterase 5. We don't know this. I looked it up. This is not my expertise. But in the process, the drug also meddles with a related enzyme in the retina. So at high doses, that's the key. At high doses, that medication can meddle with the retina, the nerve, or other parts of the eye. And the key thing, like Carl mentioned, is this metabolic risk. So people with high blood pressure are much higher risk. So if you're a person out there that wants to use Viagra, we're not telling you not to do it. And if you have high blood pressure, we're not telling you not to do it. But make sure that your blood pressure is controlled. Make sure that you're metabolically stable. And make sure you're taking the correct dose.
And John, let me add.
Yeah.
So don't forget, and also the disc at risk. So if you have the metabolic risk factors and your ophthalmologist or an optometrist or hopefully a neuro-ophthalmologist is sort of the top of the food chain. If they can tell you that you have a very crowded optic nerve with no cup, and we're not going to delve into everything that,
Right.
all the ramifications, but just a crowded optic nerve that your ophthalmologist will be able to describe to you, that does elevate the risk for ischemic optic neuropathy. So the metabolic syndrome, hypertension, diabetes, sleep apnea, hyperlipidemia, and a disc at risk, you do elevate the level of potential complications with these medications. So you
And in
should
fairness,
ask about that.
I'll emphasize one thing. Carl and I mean, do we have experience with this? Sure. We've seen patients with various eye problems related to the medication. I had a patient recently come to my office that was complaining every time he took the medication, his eyes would get red and inflamed. Fortunately, nothing serious. And I went through the dosage with him and things like that. But I think in my research that I've looked at, meaning I'm not an expert, but I've done research like any of you can do, the key takeaway that I came at with was if you're taking the correct dose, a low dose, and you're not using a counterfeit medication, which could have a higher dose than what you think you're getting, it's actually safe. And it's safe even in certain people that are high risk. But the thing is, if you're not taking the recommended dose or you're taking counterfeit medication, you're putting yourself in harm's way.
Right, right. Okay, so just to summarize and recap the risks. Viagra, Cialis, this class of medication, metabolic syndrome, disc at risk, higher potential event of ischemic optic neuropathy. If there's any question, talk to your ophthalmologist and just get an indirect or a direct exam or biomicroscopy to look at the optic nerve, and then you can discuss if it's for you or if perhaps you don't want to take it.
And I would add, make sure you're taking the correct dose. Don't take counterfeit medication.
Right,
I mean,
right.
I'm one person, you know, generic, it's fine. It's this. I'm not saying generic is bad. I'm saying counterfeit medication. When you see these ads, this is just like Viagra, be very cautious.
Yeah, yeah. That's good advice, John. Thanks so much. So thank you
But
for
go
being
out,
here.
take the
Yeah.
medication, make love, enjoy your life. We're not telling you not to take this. But take it the right dose and with the right care and the right physician.
Right, right. Very good, John. Okay, so we're going to talk about actually Ozempic and the potential complications or risks associated with that next week. Thanks, guys. Thanks for being
Thanks.
here. Please subscribe, like, and we'll see you on the next one.